We are going to get started in just a moment. Of course, you all know that I am Dr. Jennifer Bellotti, Executive Vice President of Full Spectrum ABA. Joining me for this presentation are Michelle Finikurov and Erica Leiter, both autistic advocates in our autistic advocacy program. We are going to go over autism inclusion for behavior analytic providers, particularly from an organizational perspective. So we're going to start by reviewing the abstract, objectives, and literature review. And then I'm going to pass it over to Michelle and Erica to discuss what we have done as an organization to be more inclusive of neurodivergent individuals, and in particular, autistic individuals, through programs like our Autistic Advocacy Group and forums, NTC, and UABA, which we really haven't disseminated much information on yet. So I'm really excited for us to be able to share that with you, and just different areas where we as an organization have worked towards being more inclusive, as well as strategies in general, and listening to the perspectives of both Michelle and Erica for all of you to learn from. So I am going to go ahead and get started. At any point, of course, if you have any questions or comments, just let us know. And we are really excited to deliver this training to you. So we will start. So Autism Inclusion for Behavior Analytic Providers. The CEU sign-in code for those of you who are behavior analysts is 3401. Today we are going to review, these are the points from the abstract. So what our points are, what our main headers, what we're going to address. Behavior analysts are responsible for creating meaningful employment and educational opportunities for autistics. This creates cultures of inclusivity, independence, and empowerment. The authors will discuss how to transform organizational practices to amplify autistic voices. The Full Spectrum ABA Autistic Advocacy Group, Autistic and Neurodiverse United Association of Behavior Analysts, NUABA, and Neurodiverse Training in Creative Industries, NTC, strive to accomplish this mission and will be reviewed from the perspective of autistic providers. The Full Spectrum ABA Autistic Advocacy Group utilizes Own Voices accounts to foster an environment of inclusion and support for autistic adults to learn and grow within the field, and to teach other neurodivergent and neurotypical ABA providers most compassionate practices. NTC, created by autistics, teaches digital marketing skills relevant to today's job market and celebrates the strengths of autistic individuals through an easily accessible app. NUABA is a forward-thinking organization which strives to educate ABA companies and providers on best practices in behavior analysis that are autism-friendly. The goal of these initiatives is to shift society towards becoming more inclusive, tolerant, and accepting of neurodivergence, ensuring that autistics receive evidence-based, individualized, and high-quality supports. Our objectives this evening are that you'll be able to identify and create meaningful employment and educational opportunities for autistics. You'll be able to identify the benefits of creating cultures of inclusivity, independence, and empowerment, and will learn how to transform cultural contingencies within your own organization. And participants will learn how to transform organizational practices to amplify autistic voices. Now we'll go through some research, so the literature review of inclusive practices in the workplace. Global trends and forecasts worldwide of increasing diversity in the workplace highlight the importance of examining approaches to improve workplace inclusion. Although these needs are apparent, evidence continues to suggest that there continues to be a disparity and economic inequality in the workplace. Now, why is it important to focus on inclusion and diversity from an organization perspective? First, evidence suggests that inclusion leads to negative effects on both psychological and physical health. Second, it allows us to prevent both overt and covert forms of discrimination. Overt forms may include direct acts of prejudice, whereas covert forms are more subtle policies or acts that may result in unfair or unjust treatment of certain groups. The challenge being that these subtle forms are much less likely to be viewed as legitimate, and they tend to occur far more frequently. It's essential that as behavior analysts and employers and service providers of diverse groups of people, that we are aware of what inclusion and diversity are and what are best evidence-based practices to improve inclusion within the workplace. In order to improve, we need to first have an understanding of what inclusion and diversity are. Unfortunately, there is not much behavior analytic literature to help us operationally define these terms, so we will rely on the current literature based from other fields such as human resources. The commonly utilized definition of diversity is that diversity refers to the division of the workforce into distinction categories that have a perceived commonality within a given cultural or national context and that impact potentially harmful or beneficial employment outcomes such as job opportunities, treatment in the workplace, and promotion prospects irrespective of job-related skills and qualifications. Inclusion within the workplace refers to the idea that in inclusive organizations and societies, people of all identities and many styles can be fully themselves while also contributing to the larger collective as valued and full members. Another frequently cited definition for inclusion notes that in inclusive environments, individuals of all backgrounds, not just members of historically powerful identity groups, are fairly treated, valued for who they are, and also included in core decision-making. In summary, inclusion involves equal opportunities for members of socially marginalized groups to participate and contribute, and to support employees in their efforts to be fully engaged at all levels of the organization and to be authentically themselves. The terms diversity and inclusion are often treated as interchangeable. However, there have been efforts to clarify the distinctions between diversity and inclusion. As noted by Winters in 2014, perhaps the most salient distinction between diversity and inclusion is that diversity can be mandated and legislated, whereas inclusion stems from voluntary actions. Ferdman, also in 2014, notes that the distinction may be that diversity management practices have largely focused on bringing marginalized groups, such as women and people of color, into the workplace, whereas inclusion practices have sought to create equal access to decision-making, resources, and upward mobility options for these individuals. These distinctions may be important as we seek to establish and evaluate ways organizations can create inclusionary environments and invoke practices such that diversity, not a disadvantage, and can in fact provide advantages organizationally. Workplace diversity only provides the opportunity for greater innovation, but without inclusion, such a benefit is unlikely. In other words, you can have the right people in your organization, but if they are not in the right place or valued for their unique skills, then the benefit the organization will experience is minimal. Let us now turn our attention to creating inclusive practices within our organization, specifically for the employment of individuals with autism. Employment is an integral part of almost everyone's lives. Employment provides individuals with a sense of financial security, can help determine self-esteem and social recognition, and has an impact on one's well-being. Despite the obvious importance of meaningful employment, individuals with disabilities have a disproportionately high rate of job insecurity. underemployment, and unemployment when compared to workers without disabilities. In fact, 85% of individuals with autism are not in full-time work, and of those employed, 46% are overeducated or exceed the skill level needed for their roles. With regards to some of the softer skills required for employment, autistics frequently report experiencing isolation and stigmatization in the workplace. This leads to poor long-term outcomes of adults with autism, even when they possess strong qualifications and skills. Unfortunately, a systematic review conducted by Headley et al. In 2017 suggests that evidence regarding the efficacy of employment programs and interventions for adults is weak. And Nicholas et al. 2017 found that people with autism often perceive employment support programs as not useful. Now, why do these disparities between autistics and non-autistics exist? An explanation might be a deficit versus strength-based view. Historically, definitions of autism, such as the one found in the DSM-5, focus on impairments in social communication and interactions with a combination of restricted and repetitive patterns of behavior, interests, or activities. Other studies have found that perspectives regarding individuals with autism include an inability to form their own communities, and that autistics lack the capability of self-reflection, self-awareness, and empathy. In order to appropriately support individuals with autism, it's extremely important that we counterbalance this historically deficit-based approach with a strength-based neurodiverse approach. This means that autism should be framed as a form of neurodiversity, and that the personhood and behaviors of autistic people should be described through a lens of human diversity. By highlighting the strengths and possibilities of being autistic, we are able to best develop services that support individuals with autism to maximize quality of life by ensuring access to sustained meaningful employment. Several studies have examined the factors that promote workplace participation for individuals with autism and include personal factors such as IQ, autism severity, and adaptive behavior skills, as well as family factors such as income and community size, and systemic factors such as availability and receipt of vocational rehabilitation services. However, almost none of these studies included the examination of a context that critically affects employment outcomes, the workplace environment. Several large organizations have begun systematic efforts to attract and retain neurodiverse candidates. For example, Microsoft now sponsors an Autism Work Summit for employers and researchers, and SAP discusses actively hiring for difference while tailoring jobs to individual skills. But unfortunately, these opportunities appear to be few and wide between. A literature review of studies that highlight workplace modifications that can support employment outcomes for individuals with autism will now be discussed. One perspective for improving workplace inclusivity is to use the organizational science perspective. This perspective highlights three main tenets for creating and sustaining meaningful employment for individuals with autism. The first is diversity climate, which is the degree to which an organization utilizes fair employee policies and socially integrates employees from underrepresented groups into the work setting. According to Voges and Taylor, a well-developed diversity climate creates feelings of belongingness and respect for uniqueness. An organization can accomplish this by fostering integration and learning, where differences can be viewed as a means of discussion and process improvement. This may also include attending to the individualized needs and talents of employees through flexible policies. There are frequent trainings on diversity and access to autism resource groups. The second tenet is psychological safety. So as mentioned previously, individuals with autism often experience a lack of understanding and acceptance in the workplace. Psychological safety is the shared belief that it is safe to take an interpersonal risk without fear of punishment. In simpler terms, it's the ability to have a performance error deficit without experiencing a punishing consequence from an employer. Leader inclusiveness is the last component and is the set of behaviors that foster employees perceiving that they belong. This could look like affirming uniqueness, using words and deeds that appreciate others' contributions, and leaders who tout the importance of diversity as an important part of organizational strategy and success. Another way of evaluating organizational effectiveness in securing and retaining individuals with autism could be done by looking at these 4 themes. These themes were developed by interviews conducted by an autistic self-advocacy group in the Netherlands. This group recognized the crucial importance of self-advocacy in the development of inclusive practices and cultures, and therefore proposed evaluating organizations based on these themes to improve in these areas. The first theme is invisibility of adults on the autism spectrum. The individuals with autism interviewed in this group noted both the literal, meaning having more or less visible form of autism, as well as in a metaphorical sense, where individuals felt unseen, dismissed, or discounted. The second theme is diversity of the autism spectrum. There's a famous saying of, if you have met one person with autism, you have met one person with autism. Even within the autistic community, differences exist related to what autism means to them. For some, autism is only a part of who they are. For others, autism defines who they are, and others see autism as a variant of the neurodiverse spectrum. Third is autistic leadership. Individuals with autism want to be seen as not only needing support, but also people who are capable of taking initiative, including setting up and managing an organization. We will talk more about one such autistic-run organization in a little while. Finally, it is important to establish collaboration between people with and without autism. So what do these themes mean for organizations? First, it's important that organizations take into account the fact that individuals with autism exist with individual strengths and weaknesses, and that the needs exist that aren't often seen or acted on. Therefore, we must evaluate to what extent we are fostering a safe environment where individuals are able to advocate for wants and needs, and we create the systems to support these needs. Second, a one-size-fits-all approach is not effective, nor would lead to the best outcomes, as each person with autism requires different supports in different facets of employment. Finally, organizations should foster collaboration between people with and without autism, as well as establishing a means by which individuals with autism have the opportunity to develop leadership skills and can be viewed or are viewed as leaders within an organization. Another facet to evaluate organizationally could be communication strategies. Existing communication strategies generally used in the workplace context often do not sufficiently address the specific needs of workers with autism. Some difficulties can include following social rules, understanding affect, reading facial expressions and/or tone of voice, and the need to read between the lines to navigate social groups and complete work-related tasks. A study by Tomskal and Slutska in 2021 evaluated the resources needed to improve the communication processes around recruitment, selection, onboarding, and job retention. This study interviewed individuals with autism regarding how HR processes around those 4 components of employment can be recognized to support the employment cycle of autistic people. Let's take a look at the suggestions for each of these 4 areas of employment. The findings of the study greatly suggest that instead of looking for the perfect employee, that the recruitment stage should focus more on looking for someone who can perform high-quality work with an appropriate level of support and in optimal working conditions. Therefore, neurodiverse-friendly job descriptions and advertisements should be utilized. This includes job advertisements that are written in plain language, avoiding jargon and unnecessary requirements regarding qualifications with clear information about the requirements, scope of duties, and responsibilities. This also includes a more simple style advertisement with basic rather than loud colors and fonts. The final proposed suggestion for recruitment includes a request to solve a given problem and then to make a selection for employment based upon the best solution, rather than the best CV. Regarding selection, important things to consider include competence-based assessments and focusing on skills rather than job fit. Some additional considerations include using less structured job interviews, to make all verbal instruction short and to the point, to ask questions that are precise, providing clear timeframes to conduct tasks, and to recruit with the support of a specialist or expertly trained person. It was suggested that the process of onboarding should be preceded by capacity building training for all employees, including management. These programs would promote acceptance of neurodiverse people as fit and valuable employees and how to foster an inclusive environment. Other suggestions include providing a support buddy, mentor, or job coach, encouraging asking for help, encouraging feedback, and informing on one's needs, using onboarding checklists and guides for clarification, and explaining an unwritten rules of the workplace, such as breaks, dress code, and other. Establishing neurodiverse-friendly processes during recruitment, selection, and onboarding does not guarantee employment success once the job begins. In fact, job retention is one of these least studied areas for employment success with the autistic population, so I'll focus a little more on these suggestions. First, organizations should consider supporting their employees with ASD with non-direct and electronically mediated forms of intra-organizational communication, such as emails or messaging platforms like Microsoft Teams. This is not only more convenient, but it's easier to measure, is more careful, and does not require an immediate verbal response, which is often reported to lead to increased job stress for autistics. Next is the way that meetings are structured. Meetings are viewed as less stressful if they are organized in small groups, and the frequency of meetings are tailored by regularly. Also, providing a written agenda before the meeting and minutes after the meeting can help clarify task and responsibility. Next, establishing a clear chain of command with regular instructions being provided from one person leads to better workplace organization. Message content should be precise with clear instructions. The best means of communicating tasks include providing a task sequence, checking to make sure the presented information was understood, and then potentially utilizing visual forms if applicable. Finally, in terms of providing feedback, it should be direct but sensitive while avoiding emotions that influence the communication process. Overall, results indicate that consistently finding ways to improve the communication process at each stage will help minimize perceived stress levels. And now that we have discussed the literature base surrounding inclusion in the workplace, I am going to pass the presentation over to Michelle and Erica, who are excited to share some information with all of you.
Okay, so I'll start. So as some of you know me and some of you don't, my name's Erica Leiter. I'm one of the co-directors of Neurodiversity and Inclusion, and I'm an autistic advocate at Autistic and Neurodiverse United Association of Behavior Analysis, ANUABA for short. To tell you a little bit about my background, I graduated with a Bachelor of Arts in Applied Behavior Analysis from Capilano University with a concentration in autism. I'm originally from Montreal, Canada, and I worked in several schools, community, and home settings with children and adults presenting with a range of diagnoses, such as autism, ADHD, and physical disabilities. My biggest area of interest is in teaching communication, and I'm currently working at Full Spectrum Behavior Analysis as a registered behavior technician. And actually today I just finished pursuing my fieldwork hours toward earning my assistant behavior analysis credential.
For those of you who don't know me, I know some of you may know me already, that my name is Michelle Vinicurve. I am one of the co-directors of the Neurodiversity and Inclusion program within Full Spectrum ABA, and I'm an autistic advocate for the Autistic and Neurodiverse United Association for Behavior Analysis, and for short, ANIWABA. A little bit with my background. Originally, I was from New Jersey. I was born in New York, grew up in New Jersey. My family and I moved to Florida in March of 2021. And now today I work for Full Spectrum ABA as a registered behavior technician, as well as some of my additional roles, also including with being a blogger. And I work for the School District of Manatee County as a behavior specialist. I graduated last year from Purdue University Global for my bachelor's degree in psychology with concentration in ABA. That push was from my experiences in New Jersey, as when I was originally a paraprofessional for a autism self-contained classroom. That really pushed me to really work in the ABA field, and my interest also includes with teaching communication and social skills. So now that we got to share with Erica and I shared with our experiences, we want to make sure to highlight some of our other autistic advocates' voices as well, because they were really generous in sharing their stories and viewpoints. So about with employment and inclusion. So now you will get to hear from them.
The mark of a good company is a company where they lay out the expectations clearly and they allow you to get to a place where you can fulfill those expectations. And they're sympathetic to if you don't have the experience necessary, but they're willing to train you in-house so that you can conduct yourself in a way that is productive to the company and how the company does things, because all companies do things in different ways. I mean, I've seen that, you know, different BCBA, I'm a registered behavioral technician myself. Different BCBAs have different styles, focuses when practicing behavioral analysis practices. And I've seen that difference, and it's important. I feel like it was beneficial for not only to myself but to the company as well, for them to really clearly show me like what they would like me to do and making sure I knew how to do it with me during that learning process. And I've gotten there. There's still things they have, like, I need to gain experience in, but like, I mean, there's always little things, but for the most part, I feel that I have the aptitude to do the job that I do. It's directly into how he practices their business. You know, they make sure we make sure that us practitioners understand how they want things done.
The point is about with also the fact of going beyond a person's disability. Like, it's so important to be aware that a person has it. Like, when people are hiring an employee that has a disability, but it's also important to give people a chance and to go beyond it based on their skill sets that they already have.
Once I figured out what I needed, then I was able to spell out, you know, I can't work on certain days, or I can't, you know, I just won't do it, like, in that sense, because I want to be successful. So how do I do that? I have calendars, like, to a point where no one wants to look at it because it looks like a big literature book. You know, I don't care. It works for me. Alarms, timers, like, I'm literally one of those people. And I do have to, like, set aside time where I'm decompressing for an extended period of time so I can, rejuvenate and continue what I love doing.
It's been a hard journey because a lot of people have told me I can't. And I have poor self-esteem because of all the things that I've gone through. Like, my life is hard, and I'm sure a lot of these other individuals, are going to tell you that it's been a challenge for them. And it still is a challenge. And it's hard. Like, I live challenges every day. And there's not always a lot of support for us.
Been working with Full Spectrum as an RBT for about 6 months now. In 2019, I graduated from the College of Central Florida with my AS in graphic and web design and my AA in business. Like everyone else, I was diagnosed with autism at a very young age, along with some other disorders like Tourette syndrome, ADHD, OCD, expressive receptive disorder, and a lot more that I won't waste your time with. There were and still are a lot of difficulties growing up that came with these disorders, such as needing lots of clarification with every little task in life, because the expressive receptive disorder makes it difficult to, properly understand instructions. Another was never really being able to learn how to ride a bike because of poor balance and my double vision. But even through these challenges, I was taught to always look at the positives in the situation before the negatives. To also see the glass half full instead of half empty, and to see the doors that got it open for me instead of only looking at the opportunities and the experiences that I thought were taken away from me. When you are searching for where you belong in a school environment, work setting, or social, it's very important to consider more than just, the setting itself. You also need to consider where you're going to be, whether you're going to be happy and content in the position. It doesn't really matter how much money a job makes you or how much a school can teach you. If you're not happy in the environment, you're never going to have the opportunity to grow. Something like that was became very clear to me in my whole experience in therapies, in life, in general. So your goal should always try to be to secure a setting which fits nicely with who you are as a person and what your lifestyle is. So when the job is as close to a perfect match as it can be, you and the job will mesh perfectly with your personality and your goals that you want to meet.
So now that you've had a chance to hear from some of our other group members, I'm going to present some of the research findings on strategies that can be used to create meaningful employment opportunities in our field for autistic individuals. According to Chang et al. And Shatuk et al., approximately 50% of young adults with autism spectrum disorder obtain employment following high school. That is a very low percentage of individuals. One of the most important determining factors of employment outcomes is one's repertoire of social skills required for obtaining and maintaining a job. And as we know, these are areas that tend to be more difficult for individuals with autism. So Baldwin et al. Conducted structured interviews with previously employed individuals with autism, and they had three main findings, which were that individuals experienced inadequate job training and support, intolerant coworkers, and problems interacting with supervisors and coworkers. Lerman et al. Conducted a study where they trained 5 young adults with autism to perform 4 RBT skills through behavior skills training. The skills included differential reinforcement, prompting hierarchies, behavior management, and data collection. So the participants were 5 young adults with Asperger's syndrome or PDD-NOS without an intellectual disability, and 11 children who were diagnosed with autism between the ages of 3 and 7 years old. In experiment 1, behavior skills training was used to teach man training to the adult participants. And in experiment 2, behavior skills training was used to teach discrete trial training, working with children who displayed problem behavior. The adult participants were taught to teach 2 children 2 targets through behavior skills training. Generalization was measured by collecting data on the adult participants' ability to teach 2 additional untrained targets to the same 2 children and 2 different targets to a third child who never participated in training. The results of the study found that participants required an average of 3 hours of training with the experimenter before meeting mastery criteria to work with children. BST was effective in teaching behavioral procedures to all 5 adult participants. The child participants successfully acquired the target skills. DTT skills generalized across untrained targets and children. And following training, 3 of the participants began volunteering at ABA clinics. One of them was offered a paid position within a few months after volunteering. He reported a very high level of job satisfaction, and he commented that other places of employment would not have the tolerance and knowledge that an ABA clinic has. Some of the limitations of the study were that feedback was provided to the participants after every brief teaching session, and the brief teaching sessions were only 5 minutes long. So this limits the generalizability of the findings to real-world settings where supervision is provided much less frequently to RBTs. And there was a limited repertoire of RBT skills that were taught. So future research should teach other RBT skills such as errorless prompting, individualized treatments for problem behavior, how to conducting a preference assessment, shaping, chaining, updating graphs, and avoiding dual relationships. So future research should focus on can individuals with autism be trained to implement RBT skills, receiving the same amount of supervision that's typically provided to an RBT? And can autistic individuals be trained to implement a wider range of RBT skills? And lastly, can autistic individuals be trained to implement the soft skills? Conrad et al. Replicated previous studies on autistic adults' performance of discrete trial teaching, including maintenance and feedback. The participants included 3 adults with autism and no intellectual disability who were interested in pursuing a career as an RBT. The child participants ranged from 3 to 8 years old, and they engaged in 1 or more problem behaviors. Each child participant received 15 to 30 hours of ABA therapy per week prior to the study. BST was used to train the adult participants on the correct implementation of discrete trial training. Maintenance and generalization of DTT performance was assessed in the absence of feedback, and the adult participants were taught to monitor their own performance. The results demonstrated that the participants' performance of DTT skills was maintained for 6 to 17 session days without feedback and generalized across children and settings for 5 to 11 weeks. Which suggests that the trainees may be successful under a feedback schedule that's typical for registered behavior technicians. Some of the limitations of the study included a lack of measurement and data collection on qualitative aspects of RBT skills, such as tone of voice and magnitude of praise. And the children's regular therapist was present in the therapy room for ethical reasons, which may have impacted the trainees' procedural integrity due to their prior history of receiving instruction and feedback from the experimenter. So now we will talk about our advocacy group, which was designed to increase collaboration for autistics who work within and outside of our organization. Our advocacy group communicates at least weekly, shares successes, and is an avenue to obtain mentorship opportunities and resources to aid in achieving individualized long-term goals. Additionally, the organizational leadership team provides support by hosting bi-weekly supervision and connection meetings where group members are encouraged to make a difference in the organization and field of ABA, exercising their unique strengths. Additional supports are provided to ensure success in working towards their goals. The advocacy group then delivers instruction and mentorship to neurotypical providers to best meet the needs of clients and their families and to increase inclusive practices across the field. Now, I will talk to you about ANUABA and share some of mine and my colleagues' perspectives on significant topics in our field. ANUABA is an inclusive, forward-thinking organization that's led by autistic individuals and strives to educate ABA companies and providers on best practices in behavior analysis that are autism-friendly. The goal of the initiatives is to shift society toward becoming more inclusive, tolerant, and accepting of neurodivergence, ensuring that autistics receive evidence-based, individualized, and high-quality supports. So now I will pass it on to Michelle.
So I wanted to make sure to introduce as well some of our key members that are part of ANUABA that are not with us here today. So we have two autistic BCBA trainers who are Melissa Murphy and Kristen Crimes. Melissa Murphy, she's a autistic BCBA that's living in Tampa, Florida. Her main areas of interest are early intervention, functional communication, toilet training, and feeding. Kristen Crimes, she's also an autistic BCBA that's from Greenville, South Carolina. Once she started working with families, she decided to seek out a diagnosis of autism. She works with learners of all ages and life stages in home, clinic, community settings, you name it. And then finally, I want to really also introduce with Antonio Ponte. He's the co-creator of NTICI, which we'll mention more about that later. But much of his work has been featured on social media for clients that he's worked for, including with like the nonprofit job training program and a special needs summer camp, both which gave him the hands-on experience working with children and young adults with special needs. So now I will turn it back to Erica as we'll go over more of the autistic advocacy forums that we do.
So we offer monthly forums where autistic ABA providers deliver clinical support by sharing their perspectives on a wide range of important topics. So I included some in the table on the slide. The forums are accessible to all providers within our organization. The forum provides an avenue for autistic ABA providers to act as a catalyst for change by sharing their perspective within the wider ABA community, thus raising awareness of issues that neurotypical providers may not be aware of.
I just want to add additionally that this is on the next slide about with how amplification of our autistic voices, like it is so critical that for us as autistic advocates, we're really a voice for those that, you know, that are unable to express themselves in a way. For example, like when I was younger, before I got my diagnosis of being autistic, I had a lot of communication challenges, and cognitively, I just needed more support in general. Like I was pretty much in my own world. I needed a lot more hands-on support than most people needed at the time. And it's just examples like that when it's so profound, that's where I feel like, that's where we come in and stuff, and we're able to be advocates for those who, for those who are unable to express themselves in a way like that when it's so profound. And what I love about with the forum so much is that it promotes about with collaboration and problem solving in the ABA field, because of the fact that we're really for all of us in our group, we're really getting to share our perspectives with all the providers and everyone. And even for those who are members in ANUWABA, that are from other companies and everyone that we'll share more on later, that that get to hear more of how much everybody learns from each other, and our voices are heard for best practices and everything. So now I will turn it back to Erica as we talk more about with the benefits with ANUWABA and go more in detail about it.
So I'll share some of the benefits that ANUWABA brings to other organizations. So ANUWABA strives to ensure the ongoing delivery of high quality ethical intervention. And it's a vehicle for mass approval and recognition of agencies providing autism-friendly services. This reassures consumers that they're choosing an agency that understands individuals with autism and uses current intervention techniques that best meet the needs of this population. And I'll say that that's really important because a lot of, I probably some of you may know that there's been some skepticism around ABA, and that comes from a sort of, I'll kind of call it an ugly past. But as we all know, as providers today, the interventions have been really updated, and current interventions are nothing like they were, 30, 40 years ago. And they are and they are in nature much more inclusive of autistic people, and they much more meet the needs of the population. And so having autistics share their perspective, and especially us, because we actually were both on the receiving end of therapy and we are now providers, that might give consumers some reassurance around the quality of the interventions. And now I'll pass it back over to Michelle.
So another really beneficial point that I want to add to this is that it's not only just about how much the field has evolved, but now there's with the addition of ANUWABA that there's so much more collaboration and everything with ABA companies, from our own to each other as providers to even beyond, because of the fact that we all have the same mission of improving quality of life for autistic and neurodiverse clients. And what I love about so much with what ANUWABA has to bring in our forums and everything is that everybody's learning from each other, and everybody from our forums to ANUWABA, you're learning from autistics' perspectives for those who do provide ABA therapy like Erica and I do as providers. And we both originally had ABA therapy ourselves when we were younger. So that's really beneficial of how much that more collaboration it is, combined with voices that are being heard. So now now that you've learned some of the benefits when it comes to with ANUWABA for other companies and just our advocacy group, I want to really now transition to dive in more into our personal experiences from Erica and I about working as providers today. So I'm going to turn it back to Erica so that way she could share her experiences first.
So In terms of working in the field, I started off as a behavior interventionist and supervisee in Montreal, where I'm originally from. And I worked at many different organizations offering ABA. But I unfortunately encountered some ethical dilemmas, and this forced me to leave different organizations. Some of the things that I faced were a lack of adequate supervision, and I didn't feel confident that my learning needs were truly being met. So at one of the organizations, as an example, I received feedback that I was great at delivering direct therapy, but a large part of a behavior analyst job is to interview parents. And she said that I was not making sufficient progress in that domain. Now, it wasn't the first time that I received feedback of that nature, because in college, when I did the special care counseling program, a teacher suggested that I leave due to a perceived lack of social skills. She said, "You're great in class. You are like the top student in the classroom, but I'm concerned that once you go to your practicum, you're not going to make it," she told me. But I stayed and I got outside life coaching help. And I ended up winning the award for the highest GPA, where the practicums are factored in highly to the GPA of that program. So then once I finished that program and decided to delve into ABA, I researched structured supervision programs after I had some bad experiences in Canada. And it's because I know that I thrive with structure. So the current organization that I work with was able to provide the support that I needed. And I knew right away during the interview process that they would be able to provide this support. And I'm pleased to announce that I actually finished my certification hours today toward becoming a BCBA-D, and I'm about to apply for the exam. I received really good supervision. So in conclusion, it's important for autistic individuals, and quite frankly, for all individuals, to develop self-awareness of strengths, deficits, and needs, and to learn a set of social skills that allows them to communicate effectively and advocate for their needs to be met so that they can thrive. And now I'll pass it over to Michelle.
As for me, when it came to my experiences, like as a provider, it kind of started from when I was moving to Florida more so, because it was through a network, like it was networking and everything. And I had a professional friend of mine who told about me to Dr. Bellotti and to Colin and everything. And my professional friend shared about with me my interest in the field of ABA and everything. And I was at the time still in college before I was even graduating and everything. And what was amazing was that how much with full spectrum just even giving me a chance from the beginning, like going through the whole journey and everything from the competency and everything. So from there, it was just more so of like right away I was advocating about through the experiences of like getting supervision, because I wanted to keep growing myself in the field of ABA, because I wanted to improve the quality of life for autistic and neurodiverse individuals and clients. And I've been receiving really great supervision today, in which I've had so much great contact with all my supervisors that I've been getting supervision with, and I've been like providing so much with even with my current client right now, that just even letting them like choose how the programs would be run, like giving them opportunities to be able to like choose what activities they want to even work on. And it just, the whole journey itself is just, I feel like I've gone to express my passion as a provider, like even like being so individualized, even into that even went beyond into the school district. Like everyone knows that, not everybody, but some of you may know that I work with the school district of Manatee County as a behavior specialist today. And it's because I grew in the school district as well, because I wanted to generalize the practices and everything that I've been providing through full spectrum and keep expanding it into the school setting more. So I now work as a behavior specialist today, and I've been training staff and teachers about with interventions that I get to choose. And it all goes back and forth with each other in regards to like being able to improve quality of life for individuals that are autistic and neurodiverse. And it just gives for those who, you know, I've learned that like autistic people with growing communication skills, self-advocacy, like it was all part of my journey. And I know that's what everyone is teaching now in regards to practices and everything. So now we will transition into in regards to considerations for hiring individuals with autism.
So we came up with some considerations that our group felt was important to share. So first off, it's very useful and helpful to offer an individual with autism a mentor. So during my training in special care counseling, I was assigned a specific professor to be my mentor. And this was very helpful to me because I would otherwise not know who to contact if I had a specific need. I was able to establish strong communication with my mentor, and she was able to guide me. And as a result, I graduated with honors. And she even helped me get internships or practicum placements, because at the time my interview skills were not well developed yet, and I was having trouble getting jobs. And she knew that I was able to work with specific clienteles, and through her connections, she was able to help me get internship placement. And in fact, she also was able to help me get a placement where the criteria for the course or the practicum were altered, in a sense that I got given a clientele that was considered to be more challenging, individuals with multiple impairments whose needs were truly one-on-one, but some of the requirements were to do group. And group is difficult for me because it's a lot of multitasking and tracking who's where and things like that. So she set it up for me where I still wrote a group program to show that I could identify the needs of a group and then come up with a plan. But I wrote individual programs, and I only implemented a couple of group activities. But in terms of programming, I just did extra one-on-one programs instead, and I got the same credit. And in the end, the school actually ended up hiring me in a unique position where I actually ended up doing one-on-one after my practicum. So that was a very positive experience for me. So physical changes to the environment should also be considered based on an individual's environmental needs. So Melissa, who is not with us tonight, but she shared with me that she's not able to work in environments that are too bright. And in one of her jobs, she and her employer worked together to create a workspace for her that was under a tall desk, and she reported that to be very helpful for her. So these are all considerations, and if you're helping your client find a job as well, it's important to consider the size of the setting, the lighting in the setting, how many other people work in the setting, the structure, etc., because those factors can be a large contributor into whether the person has success with the job and retains the job. And now I'll pass it over to Michelle.
Another important accommodations that are considered is about with modifying the work schedule or policy. When we think about with autistic and neurodiverse providers, and we have to also consider about with that a lot of autistic people, and I know this from my personal experiences, that there can be autistic people not everybody, just in general, that could deal with like where they're having issues with like sleeping, or like there's like medication stuff, or even like, I'll give another personal example, like with me, that I also work with the school district. And despite all these factors and everything, when we think about it, that, you know what, when it comes to a workplace, that when they get to really know the individual and stuff, based on which we'll look at more later on about with skills and everything and strengths, that sometimes even just modifying the work schedule or the policies and everything makes a huge difference in regards to you know, especially when you're talking about this in the early stages, and for people to consider that part when it comes to hiring individuals. And not only that, it's also finding the best communication method. So I know we had a forum a while back about with feedback, like how some of us like feedback that's visual or written or a mix of everything. So, you know, just finding that communication method from the start, even as early on as the interview stage, because guess what? Whenever it comes to providers hiring individuals with autism, potential autistic providers are getting to know the interviewee and the organization at the same time. So there's a lot of back and forth that everybody's learning from each other. So this is where it leads to having a very honest conversation in regards to potential employees matching their own individual needs. And it should be established from the start to be able with providing or offering suitable accommodations. So that way we're increasing acceptance in our field, and we can also referring to another organization as well, because sometimes to better meet the needs of autistic and neurodiverse individuals, it really helps a lot when you're also referring to other resources too, because we often forget that we all, again, going back from the beginning, that we all have the same mission, which is with improving quality of life, and we want to be able to provide the success including with employment and being able to, for example, become providers like Erica and I are. So these are the top important workplace accommodations that should be considered. So now we're going to move on to now where we have some suggestions that Erica, Melissa, and I came up with for people with autism looking to work as RBTs, BCBA-Ds, and behavior analysts. So one of the things to consider is about with strengths and knowing your deficits, because that's all part of advocacy. That leads to it. When I know personally that I started learning about that more so myself when I first really learned about my autism diagnosis, but that's from my experiences. But really, even that helps towards with interviewing, really like practicing those interview skills. Like I've done mock trials. If anybody else has done that here, I know I've done like those mock practices in regards to for interviewing, and that's how it comes to with gaining jobs, like especially including with the ABA field too. Like you want to be able to show like your interests, like your strengths and everything, what you can do as a provider, including with providing best practices that are individualized to autistic and neurodiverse individuals, and take advantage of the resources out there. There's so many resources in regards to like organizations and even providers themselves, and that's what providers should be giving to autistic people who want to work as RBTs and BCBA-Ds and behavior analysts. And most importantly, as one of my suggestions, and Erica and Melissa agreed about this too, about with disclosing like even your own diagnosis, which is a big asset for organizations, because you know we all have different ways of thinking, and I get that. I kind of got that quote from Dr. Temple Grandin, if anybody knows who she is, but it's true though, because of the fact that like that I know it can be controversial, and I know I've had my moments of it too. It took me a while for the school district to know, like even my supervisor, I disclosed myself like a couple weeks ago to my supervisor, through the school district as the behavior specialist, that, and it's really been such an asset for here with Full Spectrum and school district, and even in general, because of the fact that, that's one step of advocacy there, and to be able to create ways of inclusion without even knowing it. And so these are some of the suggestions that we came up with together. And now I will pass it on to Dr. Bellotti about with the neurodiverse training in creative industries and TICI.
All right, well, thank you guys. I know that we went over on time, but it was really important to be able to hear everything that Erica and Michelle wanted to share. And I'm really excited, all of us are, for you to learn more about NUABA. So I will send everyone the link for NUABA so that you can go to the site to explore the program, the organization more. A lot of you, of course, you all have access to the forums, and you all know about the Autistic Advocacy Group and all of that. But this is a program or an organization that was really created to help other organizations be more inclusive as well, and all of the points that Erica and Michelle had discussed. So we are super excited for you all to take a look at it. I, as always, will send you all the PDF of the slides. That way you have all the resources. And for anyone who needs a CEU, the CEU sign-out code is 4802. And I will put that into the chat as well. But we definitely appreciate your time. And again, if you have any questions or comments, even following the training, always feel free to reach out to us directly. So I hope everyone has a wonderful evening and a wonderful weekend, since tomorrow is Friday. So we will all connect soon. Have a wonderful night.